Hi, Victoria here. This is a real clinic, real people and a real therapist.
I do think I will probably fall asleep.
And hold really strong.
I'd like to try the German one because it was strong at the beginning.
As you lean naturally. Knuckles to the sacrum. And round the beautiful iliac crests. Clearing the way, creating some space. That's it, relaxing it down, pushing the fingers up in order to isolate the scapula. Hi, Victoria here. Welcome to the channel, and today I'm going to be massaging lovely Mandie. You've seen Mandie before for a core therapy, so I'm just getting ready for a 2-hour possibly massage of full body, face and scalp, and getting my hair back this time. Maybe a couple of grips. When she's here, we're going to be doing a little kinesiology, working out which essential oils to use in her treatment. And then we're going to pick a card and see what resonates with her today. It's first thing on a Monday, so I'm going to be choosing my own card for this week as well. So join me. Thank you for all your subscriptions, your likes and your shares. Please do send me a little cuppa if you want to support the channel even further, or a super thanks on the YouTube swipe. And on this channel you will see all manner of backgrounds and conditions, all manner of body shapes and sizes, because that is the real world and that's what I want to show you. This is a real clinic, real people and a real therapist. That when you look on YouTube yourself, you'll be able to look for whatever's concerning you in your life, and hopefully there might be something that you can resonate with one of my clients that comes and visits me in the bothy. The amount of clients who come to me and I see real benefit with their treatments, they go away feeling so much better, and that is why I do my job. I absolutely love this role, this vocation I have in life. Being able to share the treatments with you on YouTube really helps my clients to be able to talk to you guys about what's bothering them, be it anxiety or a physical issue or headache, backache, or even as severe as things like cancer and trauma. If you want to like and support me, please like the videos, share them around, and also send me a coffee or a super thanks in order to support so that I can go on to do further. Thank you very much for all your support. Love you lots. Let's spread a little healing from Victoria. So lovely, Mandie. You are here for another treatment. You're having a massage today.
Please.
Yeah, please. When was your last massage?
Gosh, that was probably just something I had when I was on holiday somewhere. I haven't had a proper good massage for a long time.
Okay. So we're doing the full body and a face and scalp massage as well. Yeah, lovely. You will be in heaven. You will be so calm and relaxed at the end that let me bring you round, because you won't want to suddenly come out of it. It's a nice place to be. So just let me bring you round.
I do
gently.
think I will probably fall asleep.
Oh,
yeah.
Nice, lovely. Okay, so before we do that, if we could pick some essential oils. Now then, you were just mentioning about your hip that you probably talked about on the video last time, actually, before the core therapy. It's your right hip, and you were just saying the MRI showed that the femur, so the very top of the leg bone, has worn away a little, and also there's some bruising on the iliac, which is the bone around it of the hip. And you're having an injection, a epidural, did you say? Not an epidural, because that's in the spine.
Yeah,
a cortisone injection on Friday, so in a few days' time, in order to reduce the inflammation.
Yeah, I think it sort of settles everything down for a while. It's not a cure by any means, but it's a way for the consultant to see if it does relieve some of my symptoms, then he knows what to do about it.
Yeah, okay. Let's choose some essential oils. I'm just going to get my glasses. So I'm bearing that in mind. Anything else I need to think about? You said you didn't sleep well last night. That was because of pain levels?
Yeah, that was discomfort. So in terms of me, that's sort of like it comes and goes. Sometimes I fall asleep straight away, but last night was difficult. It might sometimes be related to things that's on my mind because I have got worries with parents at the moment, so that's playing on my mind too.
Okay, all right. So just a little bit of sleep, but mainly the hip. Anything else?
Nope.
No, lovely. Okay, so I'm mainly going to go for muscular and anti-inflammatory oils. Of course, it's the middle of the day here, so you don't mind me using sort of more stimulating oils? Is that okay?
That's fine.
Even though it's a relaxing treatment, but it would be nice to boost the circulation a little bit to that area and the white blood cells. So I'm more thinking of rosemary and, well, in a more sedative way, frankincense. So more stimulating, I'm looking for black pepper.
Ooh, my favourite.
Yeah.
Put black pepper on everything.
Ah. You know, I had a food allergy test done recently and black pepper came up as amber. You know, it's a red, amber and green, and
Yes.
the amber came up as peppercorns, so I've got to be careful with them.
So is that something that changes over time?
It can do, but not much. Not with blood food allergy testing. It probably doesn't change that much, actually.
Okay.
So I can reduce the amount of pepper I have.
Yes.
But you know, it's very difficult to take pepper out completely from your diet. It's going to be in everything that you eat outside the home. Right, ginger definitely. That's more stimulating. I am actually thinking of clove, very stimulating and analgesic. I'd also like some chamomile because that's highly anti-inflammatory. So we've got the German chamomile there, Roman chamomile as well, two-pronged attack. But we're going to kinesiology them, and other things might come up if these ones are no-nos, maybe cinnamon as well. So, okay. So let's start off with a test. If you could put little finger and thumb together, I'm going to try and pull apart. Just turn a bit more this way so the camera can see the finger and thumb. And hold. Right, really strong, okay? So in the other hand, can you hold an oil touching it to you? I'm going to come back to this one and hold. Ooh. I had a feeling that was going to fail. I don't know. I just had a sense about it. I thought this isn't going to be good. And hold. Really strong. So how interesting. Roman chamomile, no. German chamomile, yes. German chamomile is even stronger, and it's a particular scent. Not everyone likes it, but I will be putting other things in with it. And hold. Oh yes, okay. Frankincense. So we've
yin and yang.
Yeah. So we've got a mix there because they're both anti-inflammatory and relaxing, but they come at the problem from different ways.
Oh, I see.
Yes. So chamomile is highly anti-inflammatory. Frankincense is more sedative. And frankincense on the side is also really good respiratory, which can help us with sleep.
Yes.
Am I detecting a little bit of a blocked nose, or have I got that wrong? Are you slightly blocked at the moment with your sinuses?
Do you know, yesterday when I could hear myself talking, I thought, I sound different, but I don't feel blocked up.
Echoey, yeah.
Yeah.
When you first arrived, I thought there's a tiny bit of a blocked nose there. So frankincense has come up as a positive for you. Your body knows what it needs.
Yes. Yeah.
Okay, hold another one and hold. Okay, no strength there at all. That was cinnamon. and hold. Not brilliant. And just to you.
Oh, yes.
And hold. Okay, just about. So rosemary, which I was hoping would be good. And hold. Yeah. Black pepper. And hold. Okay, that was strong. So we've got a choice here. Last one. And hold. Okay, so now the taste test, if you like, or the scent test. I'm going to ask you to smell each one, and then you can tell me which your instinct, your intuition goes to.
It's a strange smell.
That's ginger.
I can taste it now, if you know what I mean.
So can I. It's in the air. Very strong. You're not keen.
It's clove, but
Yes, it's clove. Yeah.
it's nice.
Yeah. Okay. So that's the black pepper. So rosemary.
Oh, yes.
Yeah. Very
I'm going
good.
to like them all, that's the trouble.
You weren't keen on the first two, I don't think.
It's nice.
Okay, frankincense. Last one. That's the one people aren't keen on. Yeah, but it's highly anti-inflammatory. So, shall I decide for you, or do you want to choose?
I'd like to try the German one because it was strong at the beginning. And I like the idea of the frankincense. And I'll let you choose any other.
Okay, let's pick another two. So I'm going to go for rosemary. And so let me think, we've got two base notes there and a top note. So maybe we bring in a middle note as well, then we've got a balance.
Which one's that? Is that the ginger?
This is black pepper, and
yes.
rosemary, and German chamomile and frankincense.
Smashing.
So anti-inflammatory, sedative, stimulating. Well, these are both stimulating, rosemary and black pepper.
Yeah.
But they're very good circulatory wise, so they will boost the circulation. Your back, when I'm doing the massage, will go nice and rosy. That's what I want to happen. I need an even spread of that lovely rosiness. Yeah, so
Okay,
I think that's a
go with
good
those.
mix. Right, before you go, let's pick a card.
Ooh.
So you choose any, have a delve. This is your card for the week. And turn over.
Caring.
Oh, do you want to read it out?
Seeing with depth and really understanding the connection and responsibility we all have towards each other. As a master, I act with a full and open heart, even if it takes extra time and takes me out of my way. That is very apt at the moment, and I'll tell you about that later.
Okay. Of course, you mentioned your mum and dad, so caring. You're very much a carer.
Well, that's what I'm going to be next week, because mum's having a break, so I'm going to go and live with dad for a week.
Oh, well done. How lovely. So are you working that week as well, or?
Work has been fabulous because I said I'm not going to be able to work full days, that sort of thing, so should I take some unpaid leave? And they just said, work what you can and make the hours up over time.
Oh,
So they've been caring too.
yeah. They couldn't say any better than that,
I
could
know,
they?
yeah.
Oh,
So,
nice. And it'll give you a good perspective on what's going on at home.
That's exactly
what your mum is dealing with most of the time, and also, you know, some lovely care, father to daughter.
Yes, yeah. So
Right, I've just picked mine. Being a Monday, I haven't chosen mine yet. I've got enthusiasm.
Woo! Smashing.
Well done reading that without. Have you got lenses in?
I had lens replacement 4 years ago.
Oh, you don't need glasses anymore. Oh, amazing. Enthusiasm. As a master, I see the fulfillment of my destiny clearly. Success is my right, and my eyes do not stray to the temporary setbacks along the way. Seeing the end goal with enthusiasm.
Absolutely.
So there we go. If you want to put your card down, and And I'm going to put these in a mix. German chamomile is blue, a strong blue colour because it contains azulene naturally. Okay, so if you want to bring your arms under the towel so the hands are warm, and I might now when I come to do the face and scalp massage, do you want me to wash my hands before I do the scalp or not? How are you feeling?
Fine, that's
yeah,
fine.
okay. So just for now, I might just put a little flannel to just keep the hair from bothering the neck. Is that all right like that?
Perfect.
Yeah, okay. So oil going on. It's a beautiful dark green colour because of the blue of the azulene in the German chamomile. Mixed with the more yellowy of the base of the organic sunflower oil. Lovely. Oh, it's just so moisturising. It's nice and coating. Be really good for your skin health as well. And of course, sunflowers contains many vitamins and minerals, so those naturally soak into the skin. My skin's quite dry. I'm finding I'm needing a bit more oil. That's better. Oh, lovely. Okay, just relaxing the elbows out, just bringing the hands in, that's it, lovely. Okay, Mandie, 3 nice long breaths. How's the pressure so far?
No, that's absolutely fine, thank you.
Good. So, Mandie, this is your time, no one else's. You're giving yourself the gift of a massage and that time just to completely relax, recalibrate, and accept some healing. The beautiful essential oils, and we've chosen 4 of black pepper, German chamomile, rosemary, and frankincense. So we've got some big hitters there, the beautiful oils that will help look after you. And of course, the card you've picked today is caring, and these oils are caring for you. So take yourself somewhere utterly beautiful. Whether that's a beautiful sandy beach, the top of a mountain, a wonderful fresh forest, or simply a comfortable armchair that you're familiar with. And you may well find your mind drifting to various active and busy thoughts at points during the treatment, and that is absolutely fine. And simply stand back from those thoughts as if you are a bystander and observe them arriving, passing through and leaving. And know that you can address those thoughts, if needed, at another time. And for now, this is your time to rest and heal. Bringing your awareness to some nice long breaths. Feeling the oxygen circulating via the blood through the whole body. Massaging deeply each side of the spine. So at first I am simply checking out the whole back in order to find out which areas need more attention. Thumbs strongly to the sacrum. Following with knuckles. Knuckles to the sacrum. And round the beautiful iliac crests. To the sides, where it can feel a little sensitive. And having heard about some wear and tear and bruising to those bones, then they will be helped with stimulation and bringing some more blood flow to the area with massage, but also with those lovely essential oils, especially the stimulating ones of rosemary and black pepper. And now bringing that circulation up strongly each side of the spine with long thumb sweeps. The beautiful channel that is naturally there in between the erector spinae lengths of muscle and the spine itself. Into the neck. Following from the sides of the length of the back, the spine, and then up the sides of the cervical spine around the neck. And then alternating thumbs. Clearing the way so that the red and white blood circulations can move effectively. the shoulders, shoulder points, deltoids down the lateral edges of the scapula, the anterior up over the trapezius. Scoring that lovely edge of those angel wings, clearing the toxins so that the shoulders can move more smoothly, more effectively. And then over the adrenals. The kidneys. The kidneys responding well to being warmed with that knuckling massage, and then just above them to those adrenals to help the body cope with fight or flight and any stress response. Reverse effleurage, always strongly up to the heart, gently down, strongly round the hips and up. Pushing the shoulders down. Going nice and rosy now. 2 fingers each side of each vertebra, just pressing in line with the breathing, just at the level of the discs. Clearing the way, creating some space. Enjoying the rhythm and the pace of beautiful breath work to the spine. And then clearing down the same channel. nice and warm, rosy. And then stimulating upwards in 3 swathes around the hips and waist, around the ribs and the scapula, and over the top of the shoulders. And then to the waist, the obliques, pushing down, really good to help balance the immune system. At this point there are key lymph nodes stretching down the sides of the torso. The oil has gone in beautifully. Smells amazing. And coming back up to those shoulder blades, knuckling over the top of the bone itself, agitating any impurities, toxins that are sitting there on that flat plate of bone. It feels good to have that agitated and moved. And then around the edge of the scapula once more. And picking up an arm. Lovely. Just raising that shoulder blade so that I can hook underneath the scapula and access even more of those remnants. Get them moving up and over the shoulder to the cervical lymph in the chest. Some nice rosy lines starting now. It's a good sign. Show the body is responding well. Knuckling again. And then bringing the arm out. And up and over. That's it, relaxing it down. Pushing the fingers up in order to isolate the scapula. Right. Coming out. Shake to relax. And back under. A bit more oil. Beautiful glazed greeny colour. Around the shoulders, including the arms. now some beautiful rib work to clear the impurities that sit nicely between the ribs. They sit there very happily until agitated in this manner, all the way up. Lovely, now the warmth is coming in, the rosiness is spreading, and we clear any that have been agitated, risen to the surface. We clear them back down to the sides of the torso to go into our waste factory and out, leaving some beautiful red stripes. A line of fingers all the way to the lymph node under the armpit. And then swathes, overlapping hands, starting in a stimulating fashion, out, clearing that line, the edge of the spine, and out, shoulder, arms, torso, hips. Encouraging the length of the shoulder across the top from the neck down the arm. And then more slowly, bringing the body back to a settled state. And back to the effleurage.